Okay, so we'll kick off session 2. So this session is to discover how large organizations can optimize their advocacy impact through being smarter with their resource distribution. We're exploring data-driven decision making, cross-department collaboration, and funding models to ensure every dollar contributes meaningfully to advancing your mission and reaching your community at scale. About our speaker, Jenny Zhang is from China. Jenny began her advocacy journey when her father was diagnosed with mantle cell lymphoma in 2017. She left her editing career to join House 86, China's only nationwide lymphoma organization, where she leads international cooperation. Under her leadership, the organization has grown to more than 150,000 registered users. Amazing. Guided by the principle, only patients truly understand you. She brings her experience in scaling advocacy and managing resources across large communities. Over to you, Jen.
Thank you, Develop, for introduction. Uh, Hi everyone. So happy you still keep staying in this room. And also I'm from Beijing, China. That's very far away. Although we are geographically far apart, I still feel very close because we are all working towards a common course. Please allow me to yeah, read my graph. That make it more easy for me. Um, so ladies and gentlemen, later you will enjoy more in English. Sorry about that. I hope I can make myself clear. And actually, our organization name House 086, the name 086 because the sounds of this number like lymphoma in Chinese. So that's very easy for our patient to remember our organization. And our organization funded by a survivor of Hodgkin lymphoma who saw a great need for information support during his own treatment. He's our founder. And when I joined our organization in 2017, while supporting my father, like Deborah introduced, at that time we just have a small team of 6 people there, and now 8 years later, we have 14 full-time staff dedicated to lymphoma and CLL. And also, actually in China, CLL is a very rare cancer. The incidence rate is only 0.54 for 100,000. It's quite low than Western world. So in China, when we see this cancer is so rare, we also think that it's more rare to find physicians to treat CLL. And we support CLL and SLL patients together. Now turning to our theme today, actually, I feel so humble to talk about this theme. Strategic thinking has been become more crucial in our groups. We're still developing relatively slowly in terms of strategy, but I want to share our experience. Um, we are facing a large patient population, a complex environment and diverse stakeholders, and also there's many changes in outside the world. But we have stayed focused on one thing. We keep our patients and their families at the heart of what we do, and we try to understand what the unmet needs of them. Over the past 14 years, we have launched 8 major patient survey with experts. Those data have helped us learning the journey that reveal 3 main challenges for our Chinese lymphoma and CLL patients. The first one is low treatment adherence, and the second is a 5-year survival rate that still lags behind international standards. And the third one is heavy financial burden for relapse or refractory patient. Not like Europe, everyone can get war treatment. But in China, we have limited healthcare uh, reimbursement. So to improve these outcomes, we focus on four areas. First is patient services, and then is patient advocacy, R&D facilitation, and public education. To improve adherence, we offer patient conference, second opinion support, test report explanation. Of course, our physicians are very busy. They don't have enough time. Like Doctor this morning, Dr. Kennedy, yeah, to have long talk with people. So our patient groups, because most of us are patients or caregivers like me. So we have the experience can try to expand the test report for them or ask some physicians in our online meeting to help them to understand. And our new patients guides, side effect management handbooks, and patient journals. Those things are really help our patients to understand more about their disease and treatment. For rare relapse or refractory subtypes, lymphoma, and cell, we launch program uh, like Western 911 or 112, this kind of project. That's emergency medical service. We arrange our medical resources for patients when they really in an emergency situation. And also this year we launched a defeat refractory and relapse program that is meaning to bringing together medical experts from first-tier cities to help patients access better care. And when critical drugs are not covered by insurance, we try to amplify patient voice through data, video appears. When my father was diagnosed, I even joined this video appears. And the other year, because now in China, every year our healthcare reimbursement list will be renewed, updated, and that kind of BTK already coming to China market, and then the second year it covered by healthcare system. So now our situation become better and better, but still we need to provide this insight to our government, to physicians, to pharmaceutical companies, and we join effort together, then we can solve these difficulties for patients. And we also have the channel to write letter to our healthcare authority. That kind of letter really one time works. We ask for one drugs for patients, and they immediately answer to us that that's possible in this year's healthcare list negotiation. Yeah. And over time, we have built connection with them. They now occasionally invite us to closed door meeting to provide patient insights, and we always brought our patient data survey reports. Thanks to multiple stakeholders' joint efforts, more drugs are being included in the reimbursement list every year. So how do we prioritize our limited resources? Each year before setting goals, we our middle management staff, we return to our core questions about who are we, why are we doing this, how can we do better? And those simple questions keep us aligned. Last year, we defined our whole team's vision, that is navigate patient journey, accelerate healing pathways. We think our roles are changing. We keep changing from the first stage, which is like the family members, with our patients. We show our cares for them, and we provide patient education chances for them. And then we also have more chances to give robust support, like to help more drugs covered by healthcare system. And also we provide clinical trial informations to them. And also we initiate IIT research with our professors to patients. But now we are focused on when most of our lymphoma patients and CLL, they are in a very stable situation. They are think about their quality of life. So we join some global survey to try to find a gap and to help more physicians and our multiple health stakeholders to know about that. And also, another very important thing is our group already found, like from our defeat, relapse, and refractory project, we found that there's several difficult, high risk subtypes patients. They have common symptoms, and some of them lose their life quickly, but some of them they got several like CAR T therapy and they have better outcome. And we conclude this to provide this information insights to our physicians. They will use more time to focus on these difficult patients. And also, they started their IIT research. In this year, there's more good results from it. So our founder, he has a vision that maybe patient group not only provide information, provide patient education, but also we can provide insight to our physicians. That's very important. And when we think about to how to use our resources and how to manage our projects, we believe in less is more, because there's always many things we want to do, and every staff they have new ideas, and we strive to stay focused. For example, last year we prioritize relapsed refractory subtypes while connecting patients to resources. We gathering valuable insights that we share back with physicians. This really help patients build big trust to us, because it's like when they lose any chance, they will think about, oh, there's house 086, we need to go to find them. They can give us the last ticket to find chances. And this supported several investigator-initiated trials, and this year we're already seeing promising results. Most importantly, patients and families tell us they feel more supported and empowered to face unknown. That's what I want to share. I hope to start the ball rolling by sharing my humble thoughts. I'm very pleased to learn from all of you. And I prepared 3 questions. The first one is, what is the importance of setting goals for an organization, and how are they defined, like such as vision and mission? What that mean to you? Want to share something? Yeah.
In our organization, we have a what is called a statute or something like that. When we were establishing this organization, you are writing down on paper what are your missions for this organization. And then we made a wish list, as we call it, and we have about 19-20 wishes we want to effectuate to make, but we need the money for that. and that's our mission to do that. And every 3 months we are evaluating this list and looking at it. Is it something we can do, or if not, then you have to erase it and do something else. That's how we do it.
Sharing is so early. I heard that, of course, for our organization, we started to have our mission and vision just in recent 6 years. Yeah, thank you.
We also started with the mission and vision, etc. But at this moment, we are just working on our new 5-year plan for the next 5 years. And what we said, it's nice to have a mission and a vision, but what we would like to know is where can we have the most impact? So we are now looking at it more from not from what we want, but a bit what we want, but also where do we have to go and where can we have the most impact for our patients? Is that with the government or with the patient itself, or where do we have most of our ideas that we can get to?
So I'm curious about you mentioned the impact. Yeah, we always want to have high impact and low cost. But how do you to test the impact? What criteria you will use?
Of course, you have to formulate your goals. And if you, for example, we have said something like, we see that in the whole society, we get more and more old people, we get less and less doctors. How can we deal with that? Where do we have to push the government to adapt the rules? So at this moment, it's a lot about policy. A policy at government level, at a level of donors, etc. So that's where we will get onto. And we've said, of course, this is impact and the normal things we do, like patient information, getting to patient contact, etc. That has to go on. But on top of that, we want to do something extra.
Peter, you've been very quiet, and you've got a business background as well.
Thanks. Yeah. I mean, for me, it all comes back to why. Why do you exist? What's your purpose as an organisation? And from that, then you can look at the mission and the vision. I mean, the vision you could describe as what you want to achieve, and the mission is how you're going to achieve it. But for me, it always goes back to starting with why. So if any of you have ever read Simon Sinek, we've come across him, he wrote a book about Start With Why. That for me is where it comes back to. And then you're starting to ask about the questions of alignment across your organisation. Are the things that you're doing feeding back to that why? And if they don't, why are you doing them? You can stop doing things that don't actually contribute to that purpose. So for us in CLL Support UK, we are, everybody involved in the charity, whether they're our 2 members of staff or our volunteers, all have a very direct connection with CLL. So for them, the purpose is very clear, and they have an emotional investment in the organisation. That comes with some challenges because, of course, they'll have lots of ideas that they want to pursue, and so we have to be quite considered in those ideas that we do actually take forward. And finding the funding for that is always a challenge. But I think we said in the earlier session about strategy, looking at 1, 2, 3, 5 years ahead. And that's what we're trying to move to in the charity. We've survived for 20 years. I think survive is probably the word. We've had the funding that's been regular, but every year we think, where's it going to come from next year? But I think we're trying to move into a place now where we've got a more sustainable future. And we're able to raise awareness of why we exist. And that's really important to us. So for me, it's start with why. Start with why. Look for the vision, look for the mission, and then make sure that the things you are doing are aligned with that vision. If they're not, don't do.
In Australia, you cannot register a charity without having a charter. So the charter is the purpose. And I actually don't like the term not for profit, which is what we all fall under. I like to call us for purpose organizations because we need to make a profit. We need to be able to do our work to grow. We are for purpose organizations, not for profit. Um, and in my professional sense, rather than, because I don't know the inner workings of the Leukemia Foundation model, but in the think tank space I'm in, we're an 86-year-old. We're actually the oldest free market think tank in the world. And what we found is that over 86 years, you sort of, when we brought a fundraising expert in before I joined, who went back to what are you actually doing? You've got all these programs, you're doing all these things. What are your 4 pillars? And they made us have these 4 pillars, which then articulated exactly what our mission was, what we were doing to fulfill the mission, and then that actually became the sales pitch to take to donors. And it, having that sort of one-page plan on a page, that one-page document it's then the start of every proposal you'll take to farmer, to a high net wealth donor, but everyone in the organization being on that same page. I think it's really important.
I think that's quite different mindset. Like our organization, we started from our patient needs because all of us are people who are impacted by disease, and then we know what they immediately needs and what things can give them long-term benefits, and then we started adding a little bit more, and then uh, according to what unmet needs, we finally can conclude what, like 4 pillars. We also have 4 pillars we can do. That is because we really down the ground, grows from the down ground patient group. And also, I know seated beside me is Korea patient group, and also their KBDCA is very big association. Could you introduce a little bit about your organization's mission?
Uh, Actually, our organization name is Korea Blood Disease and Cancer Association. Our association supports not only blood cancer but also tumor patients through several education program and medical reform program. So our mission is that our mission and ultimate goal is to provide accurate information and help patients return to their daily lives. So our organization conducts weekly offline program and operates about 500 programs annually. Notably, the association YouTube channel has about 8,000 subscribers, and it continues to provide education not only online but also through offline education programs, ensuring ongoing support for patients and their families. And nowadays, our mission is to convey the voices of patients to the government on their behalf. So we have collaborated with pharma companies and worked closely with lawmakers, physicians, and patients to hold policy forum aimed at securing insurance reimbursement for previously non-reimbursed medications. As a result, Lesoluk, a drug used to manage post-transplant side effects, was successfully added to Korea's reimbursement list, allowing patients to receive treatment at a much more affordable cost. The achievement demonstrates the association's proactive role in driving policy change to reduce patient burdens and improve access to care. Yeah, thank you.
And then if there anyone want to share. Oh.
So, as I'm from Max Foundation, our mission has always been like to provide uh, uh, delivering medication, and it's like every patient's right to get access to quality treatment. And our mission is like we have a 5-year strategy, and the main vision is to provide quality treatment to all the lower and middle income countries, because that is where we lack the access to treatment at the right time. There may be access to treatment, but there is a lot of stigma. There's a lot of people don't come out and speak about cancer. Cancer, leukemia is still a nightmare in most of the uh, lower and middle income countries. Maybe it's because they lack awareness. And what drives us to do this is our priority has been a human approach, and we try to align everyone: patient, physician partners, patient advocates, donors, and we as Max employees, everyone, we align into a particular strategy, and we work towards that. And how we do this is because of a collaboration with various um, advocacy network, various donors, where I can tell you how we uh, launched the CLL program in Nepal, and it was one life saving support which B1 gave to us. And till now, it is like, as I work for Nepal, I can speak like the from the ministry, from the pharmacy, from the you know, shipment agent, we all end of the day we all decide like, yes, patient should get benefited, and whatever the hindrances come at being, we get aligned on a single point, we will do it. And that is how the program has been expanding. And more than access to treatment, it needs a lot of effort where you educate the patient, make them understand that they are not alone in their journey with cancer. And uh, as low and middle income countries has like, maybe patient might understand, but the family doesn't understand, right? So that take extra effort for to conduct these support group meetings. And as you saw one of our patient leader today in the morning, we form a focus group meeting every now and then. She used to visit the hospitals, and she spends time there counseling them, and letting them know the importance of compliance and how this drug is coming, what are the effort put in behind this to get this into the country. We do have a lot of fundraising events, and it's like I can tell you one example is like in South Asia, India, there is a fundraising event called Chai for Cancer. It is like you can be conduct anywhere. It can be a park, or a community function, or someone even come forward with their family events. A cup of tea is around $5, and you can dedicate your time talking to your friends, relatives, but the cup of tea you have is for cancer patients. So that is how we do raise our funds. And recently, one was our CEO's birthday campaign, which she did last month. And she did a webinar session focusing on Nepal, how important it is to support the patients. And the entire fund raised is allocated to the initial diagnosis purpose of pediatric patients. And because maybe we can support them access to treatment, but to find out what exactly the diagnosis is, is really a struggle in lower and middle income countries because there are a lot of financial burden and uh, a child getting cancer is something which no one would wish to have that, because we have pediatric patient from 6 months diagnosing with various cancers. So this is how we do fundraising events. The next we are planning to do one in New York City, which is again goes for supporting the patients for their various tests. We do have social determinants of health where we support patients for their travel elements. We support patients for their food because we provide medicine, but there are other things which they they really cannot afford.
Um, my vocabulary is not as good as the way you talk, but I try to explain myself. Well, my organization is like the rest of another patient organization is to help the patient and the caregivers. That's our mission. We help them all across the path of the disease. And our vision, because we are an umbrella organization, we try to expand. We try to open our umbrella to another countries. First of all, to Spain, or all across Spain, to reach as much as patient as possible, and also to target as well other association Spanish who speak Spanish, which is all Latin America. So this is what we would like to do, expand our umbrella to reach more people or, Spanish speakers.
We have many umbrella organizations, and here's also a group from Tanzania. Okay.
Okay, so from Tanzania, what we do to raise funds is through different organizations who are ready to support us. So we just, for example, this September on 26th, we have walkathon on blood cancer on CLL. Yes, what's CLL Day? So we are organizing it by welcoming people to work with us, so they contribute a little bit, which go directly to help us in different activities in our organization. So through that, we get more funds, and we have invited more companies, for example, the banks, the government organizations, the NHIF, the policymakers, the leaders. So we are through that we are getting a lot of funds to help us running our activities.
Yeah, seems fundraising strategy is very important for us. So I also wondering, beside fundraising, which work area? Oh, 150. Okay. Oh, time flies so quick. Yeah. So it's very difficult part for me to run this kind of discussion, but I try my best. And also I learn a lot from all of your organizations about how to do mission and also about fundraising. There's several strategies we need to explore more. And like in China, we fundraise from several parts like patient education and clinical trial, and also we provide some apply for some funds from our government. That most of the part we got fundraising from pharmaceutical company. But it is correct, like Laura said, that we just like to run a business. Of course, if we have funds, we can do what we want to serve for our patients. So that's all I want to wrap up. If Deborah, you want.
Sorry, this has been really useful. Thank you to everyone for your participation. And I'd just like to say, share to Jenny. Thank you. Thank you very much.